Good evening, I'm Libby, and welcome to tonight's broadcast. Tonight, we will be discussing a critical medical procedure that has the potential to save lives: kidney transplantation. Kidney diseases affect millions of people worldwide, and for some, a kidney transplant becomes a viable treatment option. Joining us today are Maya and Holly, who will be sharing the advantages and disadvantages of kidney transplantation. But before we delve into that, let's understand what kidney transplantation is all about. Kidney transplant is a surgical procedure or treatment choice aimed for patients suffering from kidney diseases. A donated kidney will be placed inside the abdomen of the patients and will do the works of the failed kidneys. The kidneys of the patient will not be removed during transplant operation, not unless there's a condition that requires it. Facing a kidney transplant is a very serious matter. It is an issue of life and death. Thus, people should be aware of the different factors when it comes to kidney transplants, especially in terms of their advantages and disadvantages. So Maya, what can you tell us about the advantages or pros of kidney transplantation?
Thank you, Libby. Transplanted kidneys work just like normal kidneys. The patient will be able to feel much healthier and even more normal. The patient will have fewer restrictions on diets, so she has the chance of improving quality of life. The patient who has undergone a kidney transplant won't be needing dialysis anymore. And finally, a patient who successfully went through a selection process will have a higher chance to live a much longer life.
Thank you, Maya, for highlighting the advantages of kidney transplantation. Now, let's turn our attention to the potential disadvantages. So Holly, what can you tell us about the cons of kidney transplantation?
Thank you, Libby. There are important factors to consider when it comes to the disadvantages of kidney transplantation. A kidney transplant requires major surgery, which can cause further health problems if not done successfully. Also, this process is usually expensive. Donated kidneys are not always available. Some patients will need to wait for potential donors. One of the most unfortunate things about a kidney transplant is that the body of the patient who needs a new kidney might reject the new kidney. Thus, one kidney transplant may or may not last for a lifetime. In undergoing a kidney transplant, the patient will need to use or take immunosuppressants, which can actually cause some complications. Kidney transplantation is not recommended for those who have severe obesity, heart disease, mental disorders, and chronic illness. Should take anti-rejection medicines for the rest of the patient's life or the kidney's life. Higher risks for infections from anti-rejection medicines. And finally, frequent labs and tests to be drawn as well as doctor's visits.
Thank you, Holly, for providing us with valuable insights into the disadvantages of kidney transplantation. Though kidney transplantation serves as an excellent treatment for kidney diseases, it is still important to consider other important factors before undergoing to such a procedure. There are also other significant things to think about, like choosing the kidney transplant center, as well as the surgeon, the program longevity, comprising rate of survival, and most importantly the disadvantages. Though it may offer lots of health benefits and other advantages to the patient, kidney transplantation also offers risks and disadvantages that are well worth taking into account. Over the years, kidney transplantation is becoming more and more popular, and it shows no sign of slowing. More and more patients are requiring this treatment. Therefore, it is essential for people to know and be aware of the different pros and cons of kidney transplant. That's all for tonight's broadcast. Thank you for joining us, and remember to stay informed and take care of your health. Good night.